Hey guys, in today's video, I'm going to discuss the four most common causes of a pinched nerve in your neck. In reality, really, there are two main causes, degenerative disc disease, and the other one is a herniated disc. Now, under degenerative disc disease, we also bunch with it spinal stenosis and arthritis, because all these three conditions, degenerative disc disease, arthritis, and spinal stenosis, typically happen together. So let's go ahead and look at degenerative disc disease. So in a degenerative disc disease, in a normal, healthy intervertebral disc, which occupies the space between the two vertebrae, usually that space is pretty thick and there's sufficient space there. Now, in someone with a degenerative disc disease, that disc space has thinned out and in severe cases can cause bone spurring. Now, let's go ahead and show that further in our anatomy app here. So, in someone with degenerative disc disease, the joint space, see this is C5 and this is C6, the disc space between C5 and C6 in someone with DDD has thinned out. The problem is when it thins out, imagine this space thinning out, what happens to this opening right here? It's going to thin out that opening too, and that condition is called spinal stenosis. Unfortunately, there's usually a third layer to this. Because of the disc degenerating and that disc space thinning, causing stenosis here, it will also cause compression between the joint formed by the vertebra above and below. They join together right here in this space right here. It's called the facet joint. So that facet joint, just like the knee, when it gets compressed repeatedly over time, can develop arthritis. And when you have an arthritic joint, it usually gets enlarged. And when that joint gets enlarged and also causes spurring, it will crowd out this opening even further and can cause a pinching of that nerve that exits from that opening. Now, the other cause is a herniated disc. So let's go look at a herniated disc. So in a herniated disc, there are two main parts to your disc. You got your front and back wall and then the center jelly-like structure. So that in a herniated disc, that soft jelly-like center of the disc has pushed all the way through the outer or back wall outer ring. And as you can see here, this is a herniated disc, can cause pinching of that nerve that was exiting from that opening as it exits from the spinal cord. So there you go. Two most common causes, you got degenerative disc disease and a herniated disc. But under a degenerative disc disease condition, arthritis, spinal arthritis or cervical joint arthritis, and spinal stenosis also usually occur together with degenerative disc disease. All right, we'll see you in the next video.